times get hard, and we're here to help at NorthPoint.
Hello, welcome to another episode of NorthPoint's Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by the NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing NorthPoint's legacy in the North Minneapolis community with NorthPoint's Chief Executive Officer, Ms. Kimberly Spates. Ms. Spates, welcome to the program.
Well, thank you so much, Lisa.
Yes.
I'm glad to be here.
Thank you for being here.
Thank you.
So you have over 20 years of experience in public and nonprofit sectors. You are well regarded. You've received several awards. Tell us a bit about your background and how you came to be here at NorthPoint.
Great. Well, thank you for that question, Lisa. And I appreciate the opportunity to be here today. So, who's Kimberly Spates? Well, I'm a transplant from Texas. I've been here for over 20 years, longer than I thought it would be. And I came to this work based on what my family had instilled in all of us around being of service to others. And so my whole career has been in public service. When I transplanted here to Minnesota, I worked for the city of Minneapolis, and then transitioned to work at Hennepin County in a unique position that was really focused on African American men. And in that opportunity, I was able to come to NorthPoint. So this is where I kind of started my career in the area around community well-being and public health. And so in that process, I already had a degree in political science, and my mother would always ask me, what are you going to do with that? I'm like, well, I don't know, maybe following y'all's footsteps. You know, they both were on school boards in our communities, and my father's an educator. My mother's a small business owner. And bringing those two things together, when I came, I was like, well, I know I have to be in community. So where else should I be other than in North Minneapolis, where everybody told me that's where all the black people were. And so when I came to work with the African American Men Project, I had the opportunity to really engage in community and got to create relationships with those who have been here before me, but those who are really trying to make a better pathway for African American men. And so having the opportunity to really utilize the skills that I learned at school, the things that I was learning as being part of a county entity, right? The county makes a lot of decisions about what happens in individuals' lives. This was an opportunity to kind of be the translator, a go-between with the community and with government. And so I saw this opportunity at NorthPoint as an opportunity to really bring those two sides of my life and experience together. And it's proven to be pretty successful. I worked with the county administration for 11 years, and I transitioned and came to NorthPoint to work on the human services side, which is the nonprofit side, in 2014. And in doing so, was able to bring all the skills that I learned in county administration. And during that time at Hennepin County, I also got my master's degree in both public administration and nonprofit management, understanding that it's going to take the community who knows what they need and want, and government who has the resources, the access, the information to be able to bring those two things together to really see some change in our community. So having that background has been instrumental in my ability to work both in the nonprofit sector, but also now bringing those two things together in this role as the CEO. For a lot of folks who don't know, NorthPoint has been in this community, Pilot City, for over 55 years. And NorthPoint brings both that nonprofit, community-focused, community-led work alongside this public entity, Hennepin County, who has over a $5 billion budget, together to really focus on the things that matter to the community that we serve. And we're being led by the community because 51% of our board are patients of NorthPoint. So the ability to be in this space, I feel is a blessing, because I don't think anybody that I know except for Stella Whitney West, who was here before me, have had the opportunity to bring these two things together in a way that can really show how people of color can actually take care of themselves and don't need a lot of intervention from others, and can really build a legacy of health, well-being, wealth, on our own.
Yes. So I think it's safe to say that you understand the assignment.
I do understand the assignment.
Yes, you do. Community is in your DNA,
Yes, it
right? Okay. So let's talk about this. What are some of the most pressing healthcare challenges facing our Northside community?
Yeah, so I think some of the things that are most pressing is just access to information, right? I think we do a lot of things here at NorthPoint, and if you don't ever come into our building at Plymouth and Penn, or even our satellite sites at 800 West Broadway or at Heritage Park, you might not even know. You just might think, oh, I can go there to get a medical checkup, or I can get my teeth cleaned. But the number of services we provide in one location provides not just access to those services like dental, behavioral health, and human services. It also provides access to information, and the ability to understand that this place is owned and operated and for the community brings, to me, is a powerful place to be, because now I understand when I come into NorthPoint, these services are for me and designed for me. So how do I start asking questions about, well, what else do I need to know? I came in for this, but I see you have something else. So tell me about that something else, right? And how this is working and how this came to be, so that now when you leave us and go back to your community, you can talk to your child about, well, you need to make sure you're immunized, and you need to make sure you're going to school, so that we don't have to utilize all these services unless we really need them, because they're here for us. But here's some things you should know. So I feel like information is power, and coming here is not just about, I can get my toothache taken care of. I can also understand why I had the toothache, how it came to be, and what can I do to prevent it in the future. So we really are trying to be in this primary care preventative space, even though we know for a lot of times people come to us
for one thing.
And now you can get more than one.
I love it. So how would you say your NorthPoint's mission aligns with your personal vision for community health and wellness?
Yeah, so our mission around partnering to create a healthier community really speaks to me, because you can't do everything by yourself, right? We weren't created to actually be alone or be by ourselves. And so being able to understand what we bring to the table, our strengths, but also understanding what the community needs and what that gap is, and then connecting with others who do that work really speaks to me. What comes to mind to me is that my mother and my grandmother both always told me, there's only so much you can do, and you need to understand what your role is, and let other folks do their role. So I'm really good about that, like giving people back their work and understanding where my lane is and trying to stay in my lane, but also understanding the other lanes outside of me and how we can all come together to ensure that we are really doing our best to ensure that we are providing wraparound whole person care for individuals, because nobody comes as just part of themselves, right? Yeah, my tooth might be hurting, but I also might need food, or I need to get my eyes checked, but I have a headache all the time, and then my blood pressure might be high. So we have to really take an opportunity to ensure that when people come, we provide everything that they need if we can. And if we can't, we need to be very knowledgeable about who can, and make sure that we have that relationship to be able to get what we need for our community.
Okay. And I think, are you talking a little bit about radical hospitality?
Well, I'm talking about radical hospitality. I'm talking about excellence. I'm talking about delivering evidence-based, trauma-informed, culturally responsive services. I'm talking about all those things, because they all mean something different to the person sitting in front of us. And so being able to give them the language to use, so that we can make sure that we're meeting their needs is what's most important to me.
Right. So it's all about empowering our guests. Yeah.
Right.
And it's interesting to me, because when we have tours, people are always amazed, right? Because we are a public health care facility, and they look around and they go, wow. pretty impressive,
Mm-hmm.
you know.
Yeah.
So this is amazing. I love that. How does NorthPoint engage with the local community to better understand and address healthcare needs?
Mm-hmm. Well, you know, I think when I say Minnesota, I didn't mean Minnesota. I meant to say North Minneapolis and NorthPoint. We provide, you know, a lot of opportunities to get firsthand direct service, right, to individuals who might need it. But we also provide a space to convene and have conversations with those who are in power or have information that our community needs. And so we try our best to engage. We have a whole department that does engagement, which this team is a part of, and it's very important that we are in the community, understanding what's happening in the community, understanding who the players are, and ensuring that we are connecting in whatever way that looks like. Some things is just, I just need to know this information because I've been asked, or there's a real connection because we see some trends for the people we serve.
Sure.
Now, how do we address that trend? Who else is involved, and how do we get them to the table? A lot of times, NorthPoint is also in a unique position because we're part of our organization is part of Hennepin County. We serve individuals who touch several parts of Hennepin County. So how do we bring those parts together to provide a more holistic approach and services to individuals so that they feel comfortable coming into whatever door to get their service. A lot of times people don't want to deal with the county
Right.
or government
There's a lack
at
of
all.
trust.
Lack of trust, you know, historical
Yes.
context, historical racism, structural racism. And so NorthPoint is really a safe space for people who feel like this is their center, and they see themselves in everything that's in our center, like you talked about. And you take people on tours. We're very intentional about how the space is laid out, what's in the space, and the services that are provided. So we want people to be able to come here, whether you're a federal senator that represents our area, or you're a new arrival, or you just moved into the north side. We want you to be able to come here and get the information you need, and then be able to do what you need to do with that information to hopefully improve your own health status or the health status of your family and the community.
Absolutely. I love that. When we think about engagement, are there any recent incentives or programs that you feel have had a significant impact on the community?
I could talk about a whole lot of things.
Okay,
Lisa.
well, pick one or two.
Let me see.
At your discretion.
I mean, I think one of the biggest things that we've been able to do in the oral health space around our community outreach initiatives in oral health is really connect people to a service that's oftentimes painful. And oftentimes individuals don't really understand the impacts that oral health has on their overall health. And so our partnerships with dental, our partnerships with our human services outreach team, and our partnerships with Delta Dental, a long-standing partner of ours, have helped us to be able to expand to more schools, prevention, and also, you know, if you get to the kids, sometimes you get to the parents.
Absolutely.
But out of that initiative, we were also able to do some research around when we do screenings. You know, we screen for vision, hearing, and the dental work. And a lot of young kids needed eyeglasses. Now, a person who wears glasses has been wearing them for all of her life. I was very appreciative of the staff's time that they put into doing the research, putting a business case together, and we have a good partner in David Spencer Eyewear, who's providing discount eyeglasses to us, because, you know, back in the day it was the ugly thing in the wall that we had to go to. But now the kids get to pick the glasses that they want. We have an optometry services here as well. So when we talk about the ability to like start in one space and then gravitate out, that's what really happens here. And that's the secret sauce to me, is that even though we might have started with just screening for tooth decay, we were able to address the tooth decay and another issue that individuals might be having at the same time. And I'm not sure that happens anywhere else. And the partners that we bring along get to see a different aspect of how individuals and communities of color get portrayed, right? They don't have access, they're poor, they don't know anything, but now they can see that these are viable vibrant communities of individuals who, once they have access to what the broader community has always had access to, they can thrive.
Absolutely. And that is just a unique lens, this whole person integrated care that we have at NorthPoint. That's a huge part of our legacy, right?
Yes.
Yeah, absolutely. Yeah. So for you, what are some goals you have for NorthPoint in the coming year? What's on your list?
I got several things on my list. But one of the biggest things is bringing our board along. So I've talked about this a little bit previously, where our board is made up of 51% individuals who come to NorthPoint for services. We also connect with other individuals who might have an interest, either work or live in this area. And so our board, we have a new board, relatively new board, and they have a lot of energy. And they understand the assignment, I believe, and our ability to give them space to be able to bring their vision to light as well is going to be helpful. So we're embarking on a strategic planning process that a real broad one. Okay. That'll also include a broad community needs assessment that we're actually going out into the community and talking to the community and gathering information about what they want to see here. And that hasn't happened before, so I'm excited about that. Okay. So that's happening. And the hope is that we can set the direction, the strategic direction for the next 5 years for the organization, and that the community sees themselves in that process, and we can get more people to come back. I mean, COVID, if it taught us anything, it taught us that we have to be nimble and adaptive. And now that we have a new administration at the federal level, we have changing things at our own legislature. How do we continue to be kind of this North Star, this kind of consistent place for people to come? And it's going to take our board's leadership, which they've provided over numerous years, to do that. So I'm excited about that. I'm also excited about the opportunity to improve our operational efforts, right? Okay. So we're embarking on an operational excellence initiative, which will we'll make some changes around access. We'll also hopefully improve engagement for staff as well, and also improve the connectivity of our staff to each other. While we have two separate organizations under one roof, it's not a us versus them, it's a them. It's a one NorthPoint. So I'm looking forward to that process, bringing this one NorthPoint to life, that when people come in, they feel the radical hospitality, they feel the sense of community that's being exuded by our staff to them when they come in, and that we can meet all of our goals that we want to meet around financial goals, around retention of staff and staff satisfaction, but also our patient outcomes. We really are here to address disparities. So that's not even a conversation for people anymore. And so I'm looking forward to being able to bring that strategy and those operational things together so that we can continue to see a broader impact and change in the disparities that are happening in our community. So those are just two things.
Wow. I mean, I knew you were going to come with it. Being a Texan with the whole go big or go home mentality, that's amazing.
Yeah, it's a lot of work, and I appreciate the staff, our executive leadership team, and the leaders in the organization, as well as the staff, just being amenable to and open to the change. I know I've been here, right? People have seen me around, but she's over there in human services, right? And now being the CEO is trying to bring everything that I've learned to the table, but also bringing people along, right? Because it's a difference, right, in leadership style and in direction, and our climate has changed, right? And so how do we provide space for everyone to get in where they fit in, but also to be clear about where we want to go and setting the expectations and holding folks accountable for meeting those, because our community has some high expectations of us. They've told us in so many words, in so many ways. And so now is really the opportunity. So how do we show up?
Yeah, because they will call us out, right?
Yes. And I expect us. I expect the community to. So
that's wonderful. Well, tell me, what inspires you in your leadership role, and how do you inspire your teams at NorthPoint?
Yeah. So what inspires me is the opportunity that working in this environment provides. I mean, when we want to talk about some of the most complex socioeconomic issues for our community, this is a place where we can actually solve them. Because we have the community and these institutions at the same table. Hopefully we can get them on the same page and having the same conversation. So I'm excited about that. That's what really inspires me, because I have the ability to work with this network of community health centers across not just Minneapolis, but in Minnesota. And a lot of them have severe challenges in their ability to serve the communities we serve. And we're set up a little differently as a public entity, FQHC, Federally Qualified Healthcare Center. Sorry for the acronym.
That's okay.
And so I'm really clear about the blessing that we have here and the power that we have and what we have going on here. So the opportunity to come in and really see that impact people's lives on a daily basis is what inspires me most.
Okay.
And how I want to try to inspire others is to continue to tell this story so they understand. So people sit at the front desk, understand that interaction that you have with someone may be what determines if they get their blood pressure checked, or they get that cavity taken care of, or they get their breast exam, their mammogram, or their colon screening, right? It might be just that one interaction with you that makes them say, yes, I'll do it. And yes, I'll keep coming back. So it doesn't matter like where you are in the organization, everybody matters. And I try to bring forth in my leadership that everybody matters. And that what you bring to the table is important to our ability to continue to grow. And I try to engage. You know, I'm pretty laid back individual. I try to have fun at work. And I like to just be out among the staff and engage and let people ask me questions. I'm transparent.
You're very accessible.
Yeah, and I am. I try to be accessible as possible with some guardrails, right? Because sometimes I can go a little too far. But my hope is that people can, as I'm moving into this role and getting more comfortable as the CEO, hope that people feel like this is a safe place for them, that they see themselves in the work that they do. And they see that there's a path forward for the individuals that we work with. Because a lot of times it's just like, oh, these people are still sick. They're not getting any better. But hopefully folks can start to make those connections with each other and with the people that we serve moving forward. So.
Okay. Well, I want to go back to something that you talked about and just maybe deepen a little bit. So we are in a new administration at a federal level, and we're seeing some changes. What pledge to the community can NorthPoint make? Yeah.
So I would say that NorthPoint is here. We're available. This is a safe space. And if we don't have what you need, we'll make sure that you understand where you can go to get it. We're not like wavering with the times, right? We've been here over 55 years for a reason, right? Because we are grounded in the community. And we know that if anything comes up that we need support for, we know how to call our community, and our community shows up. When we got ready to do this project to expand that had been in the works for, 20 years, our community showed up for us. Like, this is what we need, we demand it, we deserve it, and the county responded. So I don't see us like going anywhere. I think that our community deserves the services we provide, the access we provide, the building that we have, the buildings that we are in. And no matter who's at the federal level, our community comes first. And we are here to ensure that they have the services that they need. So
I love that pledge.
Yeah.
That's a pledge we love to hear.
Yeah.
I love it.
You know, if anything changes, we'll be communicating and being very transparent about what it is. And I hope that people learn some things in this process as well, because a lot of things that are happening around us is really just like swirl. It's not really grounded in, you know, what our country was built on. And I just encourage people to investigate, ask questions. And if you're not sure, you can always come to NorthPoint and we can figure it out.
We'll help you.
With you.
All right. I love it.
Yep.
Okay. Well, I'm going to wrap this up with one other question.
Okay.
So reflecting on your career journey, encompassing both your successes and challenges.
Mm-hmm.
What piece of advice would you give to your future self?
Yeah, I think that piece of advice is just stay the course, right? And don't question what's happening around you. I didn't, to be quite honest, I wasn't even going to apply for this job. Okay, I wasn't. I'm saying this out loud now. I'm confessing.
Yeah.
And I had a conversation with one of the board members, and they were like, well, I'm hoping I'm going to see your application. Mm-hmm. And I went back and forth for a long time because, I've been here a while. You have a legacy individual instead of Whitney West, mm-hmm. and this long history. And I'm not from Minnesota. I'm not mm-hmm. from North Minneapolis. How do I make this work? Mm-hmm. And is this really something I want to do? But after that conversation with the board member, I was like, oh, okay. And a little prayer mm-hmm. and reflection. I'm like, okay, well, if this is supposed to be, it'll be. So let me just do what I know to do. And I'm here, so I know I'm on assignment, mm-hmm. right? I have work that I need to get done, mm-hmm. and I would just tell my future self, just keep moving. No matter what, just keep moving because you're here for a reason.
Love it. Thank you so much.
Thank you.
Powerful
I appreciate it.
Words today.
Thank you.
Very inspiring. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.